Okay, let's unpack this. In our modern world, we're simply drowning in information.
Uh,
Every notification, every news cycle, every scroll, it just barrages us with facts, figures, fleeting
it
headlines.
really does. It's overwhelming.
Yeah, incredibly easy to feel overwhelmed, right? To just skim the surface and maybe still feel fundamentally uninformed on what truly matters.
Hmm.
But some knowledge, some deeper insights, they aren't just useful, they are absolutely critical, foundational, really, to navigating a complex world with empathy and, well, efficacy.
Exactly.
Today, we're taking a deep dive into precisely that kind of vital understanding. Think of this as your essential guide to recognizing the nuanced signs of distress, understanding the underlying factors that drive violence and crisis, and crucially, knowing how to respond and support those affected.
And what's truly remarkable here is how these seemingly disparate professional notes and research points, when you bring them together, they begin to paint this comprehensive, coherent picture.
Wait.
It's like gathering scattered pieces of a mosaic.
Hmm.
And suddenly you see the full, vital image emerge. This deep dive offers you a shortcut, really a curated pathway to being truly well-informed on a topic that unfortunately touches far too many lives, often in the shadows.
Absolutely. Our mission today is laser focused.
Hmm.
To distill the most important, actionable nuggets of knowledge from this rich source material. We've got deeply insightful professional notes, research excerpts related to health, safety, psychological well-being.
It's a wealth of information.
It really is. And this isn't just academic theory we're discussing. It's designed to be intensely practical, profoundly insightful, and hopefully genuinely empowering for you.
Mm-hmm.
Whether you're a frontline professional, a concerned friend, maybe a family member, or simply someone committed to being a more aware and helpful member of your community, this information is intended to arm you with understanding.
That's the goal.
So let's jump right into our first critical area. We're going to equip you with a vital skill set, the ability to identify the indicators of different forms of abuse. It might sound straightforward, but as we'll see, some of the most telling signs are often the most subtle, almost whispering their presence.
Precisely.
Yeah.
It's rarely the grand theatrical displays of distress that are the sole indicators. More often, it's the consistent, almost mundane details, these recurring patterns in someone's life or behavior that, once you know what to look for, reveal a deeper, far more troubling narrative.
Yeah.
This is about learning to read between the lines, really, to see beyond the surface explanations.
And when we talk about domestic violence indicators, our minds often jump immediately to obvious visible injuries,
Right.
like a black eye or something.
Typically, yes.
But what if someone is described, or maybe describes themselves, as accident-prone? Our sources highlight this seemingly innocuous phrase as a significant, often overlooked red flag for domestic violence. It sounds innocent enough, doesn't it? Oh, I just tripped, or I walked right into a door. We've all heard that.
We have.
But when that becomes a recurring theme, a consistent explanation for, a whole list of bumps and bruises, that's when it demands closer, more suspicious attention.
That's a profoundly important point. The reason accident-prone behavior should immediately trigger a significant red flag is precisely because it's one of the most common and, frankly, psychologically insidious cover-up tactics for ongoing abuse.
Insidious, yeah.
Victims, for a multitude of complex reasons, fear of more violence, deep shame, maybe a desperate desire to protect their abuser, or even a profound sense of self-blame, might fabricate these stories of clumsiness or unfortunate mishap.
Right. They might even believe it themselves after a while.
They might genuinely believe them or convince themselves they do to explain away their injuries. And on the other side, friends, family, even professionals might unknowingly participate in this cover-up by too readily accepting these benign explanations, simply because confronting the uncomfortable truth of abuse is incredibly difficult.
It is uncomfortable.
Yeah, the insidious psychological impact of ongoing abuse can systematically erode a person's self-worth, making them minimize the severity of what's happening even to themselves. They might internalize the abuse to such an extent that these accidents become their accepted, tragic reality.
That's chilling. And building on that insight, another incredibly powerful and often hidden sign is what's described as various stages of bruising. Our source explicitly states, we don't want bruises of all kinds of colors. That phrase, bruises of all kinds of colors, really sticks with you.
It does.
It sounds almost poetic in a dark way, but in this context, it's just chilling. What's the story those different colors are painting about someone's reality that we might easily miss if we're not looking closely?
The truly chilling insight here is that those varying colors on a bruise aren't just random marks. They're a silent, tragic timeline a visual diary etched onto the skin, revealing a pattern of repeated, continuous harm that just can't possibly be explained away as a single accident.
A timeline.
Wow. Think about it. A fresh bruise might be a deep, angry red or purple. As it starts to heal, it moves through shades of blue, then greenish yellow, and eventually fades to a brownish yellow before disappearing.
Right, the healing process.
So if you observe an individual with a constellation of different colored bruises, some fresh and dark, others yellowing, others almost faded, it's a stark visual indicator that these injuries didn't occur at one single moment. This isn't a one-off incident, an isolated fall.
No.
It's a terrifying testament to a cycle of ongoing, repeated physical abuse occurring over days, weeks, or even months. It forces us to confront the uncomfortable truth of continuous, escalating violence.
So we're not looking for a definitive diagnosis here, obviously, but rather strong, undeniable indicators that warrant further, careful, and deeply compassionate attention. Maybe a gentle, supportive inquiry, if appropriate.
Exactly. Indicators, not proof, but strong signs.
Why should you, the listener, care about these specific, almost clinical details? Because recognizing these subtle but profound patterns, learning to read the silent language of suffering, can be the very first step in reaching out to someone who may be suffering in profound silence. It's about empowering you to see what others miss and to potentially open a pathway for them to seek help, even if they aren't yet ready to acknowledge the abuse themselves.
That first step is critical.
Now, shifting gears slightly from adult relationships, let's turn our attention to the most vulnerable among us, children. When we discuss child abuse and neglect, our sources highlight educational neglect as a particularly insidious concern. Specifically, chronic truancy is pointed out as a major sign.
Right.
This goes far beyond a child simply having a bad day and not wanting to go to school, doesn't it?
Oh, absolutely. Educational neglect isn't just about a child missing a few classes here and there. It signifies a profound systemic failure in the parent's or caregiver's most basic obligation, ensuring a child receives an appropriate, consistent education.
A fundamental obligation.
Yes. Chronic truancy implies a persistent, intentional pattern of absence from school without valid excuse. It's a blaring red flag that suggests the child's fundamental needs for intellectual, social, and emotional development are not being met.
Okay.
This can stem from various forms of neglect, where the home environment is perhaps chaotic, lacks structure, or simply fails to prioritize the child's well-being and future. It's a silent cry, often unnoticed by casual observers, that the child is being deprived of one of the most critical pathways to self-sufficiency and, well, a fulfilling life.
A silent cry. And when it comes to trying to get information from children, especially about potentially traumatic experiences that they might not have the words for, or maybe they're too fearful to articulate directly, our sources suggest a remarkably valuable technique: allowing them to play or draw.
Play therapy techniques.
The guidance is quite specific. Give a kid some crayons and ask them to draw their family, or ask them if they want to play dolls with you. How effective is that, really? I mean, kids have wild imaginations.
It's astonishingly effective, precisely because children communicate trauma differently than adults. Young children, in particular, often lack the verbal sophistication to articulate complex feelings or recount traumatic events in a linear narrative.
Makes sense.
They might also be profoundly afraid of repercussions if they speak openly, or they might not even fully grasp what has happened to them in adult terms. Play and art provide a nonverbal, safe outlet.
Okay, so how does that work?
Well, through drawing their family, a child might unconsciously depict themselves as unusually small, isolated, or even hidden within the picture.
Oh.
Or they might portray dynamics of conflict or neglect through the expressions or positioning of figures.
Subconscious clues.
Exactly.
Yeah.
With dolls, they might act out scenarios that are deeply disturbing to them, using the dolls as proxies for their own experiences or for the roles of others in their lives.
Wow.
Now, while it is crucial to differentiate between a child's vivid imagination and actual truth, and yes, their imaginations can be wonderfully outrageous, this method offers a surprisingly reliable and compassionate way to gain insights and open a pathway for communication. It helps you, as the observer, to see their often unspoken world through their eyes.
A way to see their world. That's powerful. So we've looked at the outward signs in individuals, from subtle bruising in adults to chronic truancy and the silent stories told through drawings in children. We've peeled back layers of behavior that demand our attention.
Yes.
But what about another profoundly vulnerable population, often overlooked, where abuse can be deeply hidden? Let's turn our attention now to elder abuse, a critical area demanding our heightened awareness.
And before we delve into the profiles of perpetrators, it's absolutely crucial we acknowledge elder abuse. Our sources emphasize being always alert to elder abuse because this is a demographic that is particularly susceptible to various forms of exploitation and harm. And often the signs are incredibly insidious, masked by dependency or isolation.
Yeah.
We need to be vigilant for all 5 distinct types that the sources lay out.
Okay, let's list them. First, physical abuse. This includes overt acts like slapping, hitting, kicking, even inappropriately restraining or over-medicating, or sexual abuse as well. Second, psychological abuse. That might involve yelling, name-calling, humiliating, threatening, or terrorizing an elder.
Really undermining their sense of self.
Exactly. Third, and this seems increasingly common, is financial abuse or exploitation, defined as the misuse of an elder's property and resources, or even a caregiver deliberately refusing to provide necessary resources like food, medication, or utilities.
That one's particularly insidious.
It feels like it. Fourth is neglect. A failure to provide basic needs, adequate nutrition, hydration, shelter, hygiene, or medical services. And this can even include self-neglect, where the elder, due to maybe mental or physical decline, is unable to care for themselves.
Right, it's not always an external party.
And finally, sexual abuse. This encompasses any non-consensual touching, inappropriate comments, exposure to sexual explicit acts or videos, or outright rape.
What's particularly illuminating here is how these categories illustrate the multifaceted and often compounding vulnerabilities of elders.
How so?
Well, for example, consider financial abuse. It could be a seemingly caring relative or maybe a newly hired caregiver gradually taking control of an elder's bank accounts, isolating them from their finances, and then subtly denying them funds for essential purchases like groceries, prescriptions, or even a warm coat.
So subtle, potentially.
Very subtle.
Yeah.
Or neglect.
I don't know.
Imagine an elder suffering from untreated bed sores, severe weight loss, a pervasive unkempt appearance, or simply being left in soiled clothing signs, often dismissed as just old age.
Right, easy to explain away.
These different forms can, and often do, overlap, making detection incredibly challenging. Many cases go unnoticed precisely because elders may be isolated, profoundly dependent on their abusers for basic needs, or suffering from cognitive decline that severely limits their ability to report or even fully comprehend the abuse.
And fear must play a huge role, too.
Absolutely. A deep-seated fear of retribution or being placed in a nursing home can silence a victim. This raises a truly important question for all of us. How can we, as members of a compassionate community, become better, more proactive advocates for our most vulnerable, like our elderly population, and ensure we're looking beyond the surface for these quiet but devastating signs?
A crucial question indeed.
We've just navigated the subtle yet profound signs of abuse in victims. Now, if we connect this to the bigger picture, understanding the profiles of abusive individuals can help us identify critical risk factors and, crucially, potentially break intergenerational cycles of violence.
Yeah, understanding the why, not to excuse, but to prevent.
Exactly. This isn't about excusing deplorable behavior. It's about gaining a deeper, more actionable insight for effective prevention and intervention strategies.
That's an absolutely essential distinction. And when we look at the characteristics often observed in abusive parents, our sources provide us with a remarkably detailed and, frankly, heartbreaking list. It paints a picture of individuals who are themselves often struggling deeply, trapped in their own pain.
It truly does. The list is extensive, and many points resonate with a tragic intergenerational cycle. It often begins with a perpetrator's own history of violence, neglect, or emotional deprivation in their childhood.
Cycle repeating itself.
Exactly. This immediately highlights how learned behaviors, coupled with unresolved trauma, can perpetuate a horrifying cycle. Many abusive parents also suffer from profoundly low self-esteem, pervasive feelings of worthlessness, or clinical depression. These internal struggles are a fertile ground for poor coping skills. They haven't learned healthier ways to manage their own distress, frustration, or anger, leading them to lash out at the most vulnerable around them.
And it seems like social isolation plays a tragically central role here, too. The sources list social isolation, suspiciousness of others, having few or no friends, little involvement in social activities. That truly severs any potential support systems, doesn't it? It's like building an echo chamber of their own pain.
Precisely. Social isolation exacerbates every single one of these issues. Without a healthy support network, no one to offer an outside perspective, no one to provide constructive feedback that their behavior is problematic, no one to offer a helping hand during difficult times, the cycle of abuse becomes profoundly entrenched.
Stuck in it.
Abusive parents are often also in a constant state of personal crisis themselves, whether it's chronic unemployment, the turmoil of divorce, overwhelming financial difficulties, or being trapped in their own abusive relationship.
Right, constant stress.
This unrelenting chronic stress, when coupled with rigid, often wildly unrealistic expectations of a child's behavior. Imagine expecting an infant to never cry, or a toddler to act with the emotional maturity of an adult, becomes a breeding ground for intense frustration, which then tragically escalates into frequent, harsh, and often violent punishment.
That combination, unrealistic expectations and poor coping. It's toxic.
Incredibly toxic.
So it's this incredibly toxic confluence of unresolved personal history, deep internal struggles like a low tolerance for frustration and poor impulse control, and relentless external stressors that create a profoundly dangerous environment for a child.
Yes.
Our sources also mention a history of severe mental illness, violent temper outbursts, and a heartbreaking tendency to look to the child for the satisfaction of their own unmet needs for love, support, and reassurance, often projecting their blame and frustrations onto the child.
Using the child inappropriately.
They essentially perceive the child as bad or evil and lack effective parenting skills, often being fundamentally unable or unwilling to seek help for themselves.
It's a truly tragic and self-perpetuating cycle. Their own profound, unmet emotional needs, frequently compounded by a history of drug or alcohol abuse, and an overwhelming feeling of having little or no control over their own lives, all converge to create a dynamic where the child becomes a convenient, accessible target for their misdirected frustration and an inappropriate, devastating source of emotional fulfillment.
Wow.
Again, this isn't about creating excuses for horrific behavior. It's about providing you with a deeper understanding of the incredibly complex tapestry of interwoven factors that contribute to these tragic situations. This detailed insight can then inform more effective pathways to breaking these destructive cycles and intervening meaningfully.
Absolutely. Moving on to another critical, albeit deeply uncomfortable area, our sources also shed light on psychosocial factors often associated with sexual offenders. Again, understanding these complex factors is crucial not for sympathy, but for effective prevention, intervention, and creating safer communities.
What's particularly compelling here is how many of these factors don't just exist in isolation, but often cluster together, creating a uniquely dangerous combination of predispositions and influences.
A cluster effect.
Yes. The source lists impulsive and antisocial tendencies, which speak to a profound disregard for societal rules, the rights of others, and a lack of empathy for the well-being of their victims. There's also a common association with sexually aggressive and delinquent peers.
Right, the peer influence.
Which creates a powerful echo chamber where harmful behaviors are normalized, reinforced, and even celebrated, leading to a distorted view of what is acceptable.
And a preference for impersonal sex. That sounds like a key, almost clinical distinction.
It is, absolutely. Impersonal sex suggests a profound emotional detachment, where the sexual act is stripped of intimacy and genuine connection. Instead, it becomes a transaction of power, an act of dominance, or a means to fulfill a purely physical urge without any consideration for the other person's humanity or consent.
Detachment facilitating harm.
Precisely. This detachment facilitates the act of assault because there's no empathy or reciprocal intimacy involved. This is often alarmingly coupled with hostility toward women, which further dehumanizes victims, reducing them to objects rather than individuals deserving of respect and autonomy.
Dehumanization is key there.
And crucially, a profoundly significant factor often observed is a childhood history of sexual and physical abuse or witnessing family violence. This highlights the intergenerational aspect of trauma, a heartbreaking phenomenon where victims of abuse can, tragically, become perpetrators themselves, perpetuating the very cycle of harm they experience.
That cycle is just devastating. And then there are often disturbing societal dynamics at play, too, beyond individual psychology. Our sources mention membership in a gang, or belonging to broader societal groups that often subtly or sometimes overtly refuse to acknowledge or condemn acts of sexual assault. The sources specifically call out some parts of the military, prisons, and even parts of the Peace Corps to a smaller degree.
Exactly. These group dynamics can create incredibly toxic environments where sexual assault is normalized, excused, or even actively enabled by a powerful culture of silence, a misplaced sense of loyalty, or a perceived need for cohesion that tragically overrides fundamental ethical considerations.
Group silence.
In such settings, Speaking out against assault might be seen as a betrayal of the group, rather than an act of justice. This can be due to rigid hierarchies, a shared identity that fosters an us versus them mentality, or simply a collective refusal to acknowledge the severity of such acts.
Wow.
Understanding these complex profiles of perpetrators is one crucial piece of the puzzle, but equally, if not more important, is knowing precisely how to respond and what vital support systems are in place for victims of such profound harm.
Here's where it gets really interesting, where knowledge translates directly into action and empowerment. We're now going to delve into the actionable advice and protocols for supporting individuals through crisis and beyond.
The practical application.
Exactly. And we begin with a foundational concept that, while seemingly obvious to many of us today, has historically been deeply misunderstood and tragically violated, especially within relationships. The absolute imperative of consent.
Critically important.
Our sources are incredibly clear on this. Marital and spousal rape and a commitment but no still means no. And further, with unequivocal force, you don't have to have sex with someone just because you are married to them. You can't be forced to have sex. It's against the law.
This level of clarity is not just vital, it's revolutionary, frankly, because it directly challenges centuries of historical perspectives and legal frameworks that often viewed marriage as an automatic, irrevocable consent to sexual intimacy.
Right, like ownership.
Or that a spouse automatically had a right to their partner's body. This explicit guidance states, in no uncertain terms, that consent must be ongoing, freely given for each interaction, and can be withdrawn at any time, regardless of relationship status.
Ongoing and withdrawable.
It fundamentally reinforces the absolute non-negotiable nature of no. The law protects an individual's bodily autonomy within the confines of marriage, just as rigorously as it does outside of it. Marriage is a partnership, not a surrender of self.
A partnership, that's key. And it also directly addresses one of the most insidious and devastating myths surrounding sexual assault. The abhorrent notion that intoxication somehow negates consent or shifts blame to the victim.
Ugh, that myth is so harmful.
It is. Our sources are unequivocal, cutting through any ambiguity. Alcohol is still the #1 drug that we consider a rape assist drug. Rape is never the victim's fault, no matter if they were drunk or high.
Never the victim's fault, period.
And the ability to withdraw consent is further highlighted with critical importance. Even if they are in the middle of sex and the person says they want to stop, the other person has to stop. No is no. You are allowed to change your mind.
This is a critical point that, frankly, needs to be shouted from every rooftop until it's universally understood. Intoxication is a tactic often exploited by perpetrators to incapacitate and disorient their victims, never an excuse for their actions.
It's a weapon, not an excuse.
Exactly. It underscores the undeniable fact that true consent must be enthusiastic, clear, and continuous. A person cannot give genuine consent if they are incapacitated by alcohol or drugs.
No capacity, no consent.
And even if they initially consented, they possess the absolute right to change their mind at any point, even mid-act, and the other person must stop immediately without question or negotiation.
Immediately.
This principle connects to the broader societal conversations about fundamental bodily autonomy and the robust legal frameworks that exist to protect individuals from sexual assault, unequivocally rejecting victim blaming in all its forms.
So, given these crucial understandings of consent, if an assault does occur, what are the immediate actions and evidence preservation steps that are absolutely critical for victims of sexual violence? Our sources provide incredibly detailed, life-saving advice.
Yes, practical steps are vital here.
One key point, which takes immense pressure off an already traumatized individual, is that a victim has the option to report later, not necessarily immediately.
Yes, that's crucial for empowering the victim, allowing them the space and time to process the profound trauma they've experienced before making a potentially life-altering decision about reporting to law enforcement.
Giving them back some control.
Exactly. But what's even more critical for preserving their future options, whether they decide to report immediately or at a later date, is meticulous evidence preservation.
Meticulous.
The advice from our sources is stark, direct, and incredibly specific. Do not wash your hands or face. Do not shower or bathe. Do not brush your teeth. Do not change clothes or straighten up the area where the assault took place.
Those instructions are so clear, so direct, almost counterintuitive, right? For someone who feels dirty and violated, the instinct must be to wash immediately.
It absolutely is. But every single one of those actions, from showering to brushing teeth to changing clothes, can tragically destroy or compromise crucial forensic evidence. Okay, we're talking about DNA, fibers, hair, skin cells, bodily fluids, all of which could be vital for a future investigation and for securing justice.
Vital evidence lost.
Even if the victim is deeply unsure about pressing charges in that moment, undergoing a forensic examination, often referred to as a rape kit, preserves that evidence for a set period. Our sources also compassionately guide us on providing information about where to go: sexual assault response teams, violence prevention centers, crisis centers, or emergency departments.
So there are resources available.
Yes, and they clearly specify that a victim can still have a forensic examination even without the rape being reported to the police, which is a monumental shift in empowering survivors with choice.
That's huge. Preserving options without immediate reporting. And beyond the forensic examination, crucial practical medical steps are also highlighted. We learned that Plan B and antibiotics are given for rape victims.
Right, addressing immediate health concerns,
Yeah.
pregnancy and STIs.
And a urine sample is testing for the date rape drug. The sources even address how to involve family members or support systems without compromising the victim's autonomy or privacy. Contact the family to pick up victim, but do not tell them information on the incident. Do not disclose information.
That last point about family contact is a testament to the immense sensitivity and respect for autonomy required in these situations.
Yeah.
The immediate goal is to provide immediate, practical support for the victim, getting them safely out of harm's way and to a place of care,
Support without disclosure.
while absolutely safeguarding their privacy and ensuring that they control what information is shared and when. This entire sequence of information is incredibly practical and vital for anyone who might find themselves in a position to help a victim of sexual assault.
Really practical.
It empowers you to ensure their choices are respected, their immediate medical needs are met, and crucial evidence is not irrevocably lost, preserving their options for healing and justice.
Now, moving from the immediate crisis response to ongoing safety and the terrifying reality of intimate partner violence, our sources delve into building a proactive safety plan.
A safety plan is essential.
It explicitly emphasizes the critical importance of working with a domestic violence advocate, which makes perfect sense given the complexity and danger involved. This isn't just a generic checklist, is it? It's a tailored, strategic guide for survival.
It's a meticulously crafted strategy for survival and ultimately for escape. The plan outlines key components designed to minimize danger during a volatile incident and secure essential resources for a fresh start.
Okay, like what?
For instance, the advice to move to a room with more than one exit, avoiding rooms with potential weapons such as kitchen knives or heavy objects, is profoundly strategic.
Smart. Fewer weapons, more exits.
It's about minimizing the abuser's access to means of harm and maximizing the victim's escape routes in a heated, dangerous moment. Furthermore, knowing the quickest, safest routes out of both home and workplace and checking employer resources for things like security escorts extends this vital safety net beyond the immediate domestic setting.
Planning ahead, even outside the home. And the go bag idea is so incredibly practical, yet so emotionally charged. Keep a bag packed with essentials. Clothes, valuables, documents, BG passports, social security cards, medical records, bank cards, birth certificates, a list of phone contacts, a month's supply of medications, and money.
All the critical items.
And crucially, it says to keep it hidden, but make it easy to grab quickly, or consider keeping it with a friend, relative, or at work so that it is not discovered by the abuser. Imagine the sheer courage it takes for someone to quietly pack that bag, knowing it could be their only ticket to freedom.
That hidden, easily grabbable bag is far more than just a collection of items. It's a tangible lifeline. It means that when a crucial, fleeting window of opportunity to leave opens, a moment of relative calm, or when the abuser is absent, the victim isn't frantically scrambling for necessities.
They're ready.
Instead, they have the means to sustain themselves and their children, with vital documents needed to reestablish a life elsewhere. It's a bundle of hope, a defiant act of self-preservation in the face of immense danger.
A bundle of hope. I like that.
And building a covert support network is also incredibly key. Tell your neighbors about your abuse and ask them to call the police when they hear a disturbance.
Using the community.
And have a code word to use with your children, family, and friends when you need help. Imagine a simple, seemingly innocent code word slipped into casual conversation. A specific phrase or a particular question signaling immediate, urgent need without alerting the abuser.
A secret signal. Wow.
These steps are about establishing external lifelines, quietly building a network of support without provoking further danger from the abuser.
The plan also emphasizes selecting a safe place to go, a trusted friend or relative's home, or a shelter specifically designed for victims of domestic violence. And a very important caveat that underscores the constant, terrifying assessment a victim must make. Use your instincts and do not provoke the abuser when considering leaving.
Instincts are key.
And unless you are in danger at that moment, try to leave when the abuser is not at home or around you. This all points to safety being paramount above all else.
Exactly. Safety first, always. It acknowledges the extreme, life-threatening danger involved in leaving an abusive relationship and prioritizes strategic, calculated departure over impulsive actions that could tragically escalate violence and put lives at greater risk.
Strategic departure.
It culminates with a clear affirmation. You have the right to protect yourself and your kids, and wisely points to the National Domestic Violence Hotline for further guidance and expert support. These safety plans are not just guidelines. They are critical roadmaps out of peril.
Absolutely critical. But beyond individual safety plans, what about the broader professional and systemic responses to abuse and crisis?
Yes, the role of professionals.
That's a perfect segue. Our sources clearly define the critical, often legally mandated role of certain professionals, like nurses, in reporting abuse. It clarifies a nuanced but very important distinction. We as nurses are reporters of abuse, but we can't say charges should be pressed. This seems like a careful balance between ethical obligation and victim autonomy.
It is an absolutely crucial distinction, vital for both legal integrity and ethical practice. The professional, such as a nurse or social worker, has a mandatory reporting obligation when they suspect abuse. They are legally bound to call authorities and provide victim contact information.
Mandatory reporting. Got it.
This is about protecting potential victims and initiating the investigative process to ensure public safety. However, the profound decision to press charges rests solely and entirely with the victim.
Solely with the victim.
Forcing or coercing a victim to press charges, or even subtly suggesting it, would fundamentally undermine their autonomy, could re-traumatize them, and might even place them in greater danger.
Right. It could backfire badly.
This also profoundly highlights the importance of always follow your protocol, pull out your policy. Not meticulously following established protocol, as the source unequivocally states, can ruin someone's case, potentially leading to charges being dropped because of mishandled evidence, a broken chain of custody, or procedural errors that compromise the legal process.
Follow the protocol, protect the case. Makes sense. So it's about adhering strictly to professional boundaries and meticulous procedure to ensure the integrity of any potential legal case, protecting both the victim and the process itself.
Precisely.
And our sources even mention a highly specialized role within this framework, the forensic nurse.
Yes, the forensic nurse is a highly trained and absolutely invaluable professional who plays a specific and critical role at the intersection of healthcare and the justice system.
Healthcare and justice combined.
They are specially trained to collect evidence meticulously and thoroughly, ensuring it meets the stringent legal standards required for court. Crucially, they also do testimony and have to go to court to testify as expert witnesses.
Specialized testimony.
Their specialized training makes them uniquely equipped to bridge the gap between medical observation and legal requirements, providing objective, evidence-based testimony that is often pivotal in abuse and assault cases. This distinction between general reporting and specialized forensic collection is crucial for anyone interacting with victims, ensuring legal processes are respected while providing the maximum possible support within professional and ethical boundaries.
That clarity is so important.
We've just explored the signs of abuse and the crucial immediate steps for intervention. This raises an equally important question. What happens after the initial crisis? And how do we effectively support recovery and manage high-stress situations?
Right, the aftermath.
Understanding the profound psychological aftermath of trauma is just as important as identifying the initial signs of abuse and knowing how to respond in the immediate moment.
Absolutely. Our sources discuss rape trauma syndrome as a very specific variant of PTSD, post-traumatic stress disorder, and a common, deeply impactful outcome of psychological trauma, noting that untreated trauma can have truly devastating effects.
Devastating is the right word.
It explicitly states with powerful clarity, it is not unrealistic to think someone will have long-lasting trauma from getting raped. And it breaks down the syndrome into two distinct but interconnected phases.
That's right. The acute phase begins immediately after the traumatic event, whether it's hours or days later. It's characterized by profound shock, numbness, and disbelief.
Shock, numbness, disbelief sounds overwhelming.
It is. During this phase, the victim might outwardly appear calm, strangely composed, or even detached. However, internally, their cognitive function can be severely impaired. They might struggle profoundly with basic decisions, with problem solving, or even with concentrating on simple tasks.
So calm on the outside, chaos inside.
Exactly. This apparent outward calm can be deeply misleading to those around them, who might mistakenly assume the victim is fine or handling it well, when in reality they are in a state of profound internal dissociation.
And then there's the long-term phase, also called the organization phase. This can be profoundly delayed, beginning weeks, months, or even years after the assault.
Years later, wow.
This phase is characterized by intense flashbacks, nightmares, and phobias, as well as a range of somatic and gynecological symptoms, indicating that the body itself can manifest this deep distress. It sounds like the trauma doesn't just impact the mind, it can quite literally rewire the brain and body.
Precisely. Trauma has a physiological impact, fundamentally altering brain chemistry and neural pathways, leading to these delayed but powerful responses.
Okay, what are some of those specific symptoms?
The sources detail specific PTSD symptoms related to sexual assault with harrowing clarity. First, re-experiencing the trauma through recurrent intrusive thoughts, vivid nightmares that replay the event, or terrifying flashbacks that make the past feel terrifyingly present.
Like reliving it over and over.
Second, social withdrawal, sometimes chillingly referred to as psychic numbing. This isn't just sadness, it's like an emotional circuit breaker where the mind, overwhelmed by the sheer intensity of the trauma, shuts down its ability to feel anything at all, good, bad, or indifferent, as a desperate, unconscious way to cope with unbearable pain.
Psychic numbing.
That sounds awful.
They might appear strangely detached, but it's a profound symptom of their internal struggle. Third, avoidance behaviors, where the individual consciously or unconsciously steers clear of places, activities, people, thoughts, or feelings that could trigger memories or sensations related to the rape.
Avoiding reminders.
Fourth, increased psychological arousal, manifesting as an exaggerated startle response. Hypervigilance, a constant state of being on edge, scanning for danger. Persistent sleep disorders, or profound difficulty concentrating.
Constantly on edge. Finally, fears and phobias, which can become debilitating, like a crippling fear of being alone, an aversion to any sexual encounters, or irrational fears of specific environments, whether indoors or outdoors, that remind them of the assault.
Debilitating fears.
Understanding these phases and the breadth of these symptoms is vital for empathy and for guiding appropriate effective interventions, ensuring that the victim's complex and often long-lasting experience of trauma is validated and addressed comprehensively.
Validation is key. And when it comes to supporting victims of sexual assault, our sources also discuss psychopharmacology, detailing recommended medication approaches that can play a crucial role in managing the overwhelming symptoms.
Yes, medication can be part of the picture.
For immediate relief, short-term benzodiazepines may be used for acute anxiety and agitation.
Yes, these medications serve as a rapid temporary measure to calm the immediate overwhelming distress. Think of them as a fast-acting calm down button for the nervous system, specifically designed to take the sharp edge off overwhelming panic, severe anxiety, and intense agitation that can occur immediately after a traumatic event.
A temporary calm down.
They provide a crucial respite, allowing the individual to stabilize. For deeper, more chronic, and long-term management, particularly for the persistent symptoms of PTSD, antidepressants like selective serotonin reuptake inhibitors, or SSRIs, may be helpful for symptoms of PTSD, such as hyperarousal, agitation, and insomnia, and in the treatment of depression and panic attacks.
So SSRIs for the longer term.
So you have the immediate calming agents for acute crisis, and then the longer-term medications that gently work to rebalance brain chemistry over time, addressing the chronic symptoms of trauma and related mood disorders, helping individuals reclaim their emotional equilibrium.
Okay, that makes sense. Beyond specific traumas like sexual assault, our sources also provide a comprehensive framework for understanding crisis in a broader sense, defining different types and the universal phases individuals typically go through.
Right, crisis isn't monolithic.
For instance, there's a developmental crisis, which occurs during normal, predictable growth stages when a person struggles to cope with the challenges inherent in major life transitions, like adolescence or midlife.
Exactly. And then there's an existential crisis, which isn't about external events so much as a profound internal questioning of life's purpose, meaning, or spirituality.
The big why questions.
This can be triggered by deeply significant life events, whether positive or negative, like marriage, the devastating death of a loved one, children leaving home, or even reaching a milestone age like turning 40, which prompts a deep reflection on one's life choices and trajectory.
Turning 40, I can see that.
But beyond these types, It's particularly compelling to note the general progression of any crisis, outlined in 4 phases. This framework helps us understand that crisis isn't a single, isolated moment, but a dynamic, unfolding process.
Yes, understanding that progression itself is key to intervention. In phase 1, a person confronted by a conflict or problem experiences a surge of increased anxiety. Their initial response is to try to use their normal, go-to problem-solving skills and establish defense mechanisms to cope.
Using the usual tools.
Think of it like a small crack appearing in a sturdy wall. Your first instinct is to try to patch it with familiar tools.
If that initial patch-up doesn't work, if the problem persists or intensifies, then phase 2 kicks in. The threat remains, their usual coping responses fail, and anxiety continues its relentless climb.
Anxiety rising.
Functioning becomes noticeably disorganized, and the individual starts trying different, often desperate trial and error attempts to solve the problem and restore a semblance of balance. The crack in the wall is widening, and your usual quick fixes aren't holding.
Trial and error, getting desperate. And then comes phase 3. If those trial and error attempts fail and the problem continues to loom large, anxiety can escalate to severe or even panic levels.
Panic territory.
At this point, the person might mobilize what are called automatic relief behaviors, which can look like emotional withdrawal, literal flight from the situation, or engaging in behaviors that provide temporary, often unhealthy escape.
Trying anything to feel better.
Sometimes there's a painful compromise, a redefinition of the situation, or a forced reevaluation of needs. The example given is reluctantly giving in on child visitation during a bitter divorce, simply to end the agonizing conflict. The wall is now showing deep fissures, and you're desperate for any solution, even a painful one.
And finally, phase 4. If the problem remains stubbornly unsolved after considerable time and exhaustive effort, and all coping skills are utterly exhausted, anxiety completely overwhelms the person.
The breaking point.
This is the most dangerous and devastating phase, leading to profound, serious personality disorganization, deep depression, severe confusion, potential violence against others, or tragic suicidal behavior.
That's incredibly serious.
The source explicitly notes, with heartbreaking accuracy, that after so long of a problem not being fixed, people can feel that they don't want to live.
That's hopelessness.
This critical framework helps us understand that crisis isn't a static point, but a dynamic, often escalating process. Knowing where someone is in that process, what phase they're in, can profoundly guide how you can best offer support and intervene strategically, ideally before it escalates to the most severe and irreversible outcomes, preventing the entire structure from collapsing.
So understanding these phases is one thing, a crucial piece of the puzzle. But how do we actually assess and intervene effectively, compassionately, and safely in a real-time crisis situation?
The how-to.
Our sources give us some truly practical, actionable steps. First, and logically always, assess for injuries first. Physical help before mental help.
That's a fundamental foundational principle of care in any crisis. Address immediate physical threats to life or limb before moving to psychological or emotional support. You cannot help someone process trauma if they are bleeding or unable to breathe.
Maslow's hierarchy, essentially. Physical needs first.
Precisely. Once physical safety is addressed, the very next critically important step is to always make sure a patient isn't suicidal first and then carry on with the next steps.
Always check for suicidal ideation first.
A powerful insight here is that you know you're making crucial progress when the patient verbalizes suicidal feelings. This isn't a sign of failure. It's a sign of trust, a shift from private, internal planning to seeking help, a moment where they are reaching out from a place of profound despair.
That's an incredibly powerful insight verbalization as a step towards safety, not away from it. And then there's the profound emphasis on therapeutic communication, which sounds straightforward, but is deeply skilled.
It really is a skill.
Things like, set up a safe place to talk, especially with kids. Make sure they feel safe with you. The environment is good to share. Show that you are listening, not on your phone, and you are paying attention to them. Ask their name. Say things like, I want to help you. Stay on track. You're the calm. They are the storm.
Creating that safe container.
These aren't just polite suggestions, are they? They're the essence of building rapport and truly connecting.
Not at all. These are the absolute cornerstones of building trust and rapport, especially when someone is in the throes of crisis. Establishing a physically and emotionally safe environment and consistently demonstrating active, non-judgmental listening, truly being present, creates the essential psychological space for a person to open up.
Being present.
For a child, a calm, predictable, and fully present adult who genuinely offers to help is a vital beacon in their terrifying storm. This also includes the crucial step of assessing situational supports by asking specific, probing questions.
Okay, what kind of questions?
These aren't just casual inquiries. They are designed to map out a person's existing network of resilience. You'd ask, whom do you live with? Whom do you talk to when you are overwhelmed? Whom can you trust? And who is available to help you?
Getting a sense of their network?
You also ask about partners or significant others, whether they have spiritual beliefs or attend a place of worship, whether they attend school or any activities, groups, or clubs, and vitally, during difficult times in the past, who was there to help you?
These questions really help paint a comprehensive picture of their existing support network, or tragically highlight a crucial lack thereof.
Exactly. They help determine if there's a hidden network of strength, a wellspring of resilience, or a profound, dangerous absence of support. It's also important to assess their usual coping skills, what has worked for them in the past, and whether their religious or cultural beliefs need to be thoughtfully considered and incorporated into the support plan.
Consider the whole person.
Ultimately, this meticulous assessment helps determine the appropriate level of intervention needed. Primary intervention focuses on proactive measures like education, environmental manipulation to reduce stressors, or teaching new, healthier coping skills. Secondary intervention is direct, immediate crisis intervention for acute situations. And tertiary intervention is long-term rehabilitation and ongoing support for those with chronic issues or lasting trauma.
Different levels for different needs.
These are the truly practical tools for genuinely connecting with someone in crisis, allowing you to offer tailored, effective support rather than a generic, one-size-fits-all approach.
Tailored support, that's the aim. Finally, we need to talk about managing aggression and violence safely, particularly in professional settings, but with crucial takeaways for everyone in their daily lives.
A very challenging but necessary topic.
Our sources really underscored the paramount importance of safety for the professional themselves, stating quite directly that it's okay to leave room if verbally assaulted and de-escalation fails.
That's an absolutely critical point for any professional working with individuals who may become aggressive. A nurse's or caregiver's safety is paramount. You simply cannot provide effective, compassionate care if you yourself are being harmed or are at risk.
Can't pour from an empty cup, right?
Exactly. If de-escalation techniques, which are always the first line of defense, are not working, disengaging and creating physical distance is not only the safest course of action, but also the most professional.
Safety first.
And for nurses who have been injured at work or anyone involved in a high-stress, potentially violent incident, critical incident stress debriefing is absolutely essential. This isn't about assigning blame.
No.
It's a structured process to review what happened, how it impacted the staff, and collaboratively determine what we can do better next time to improve safety protocols and support systems.
Learning and improving safety. And for public outbursts, like in a waiting area or a crowded space, the advice is quite simple but effective. Ask that person to move to a quiet place away from the group.
Simple but effective.
This seems like a straightforward yet powerful de-escalation technique.
It is, powerfully so. Removing the audience, reducing external stimulation, and moving to a less confrontational, more private environment can often profoundly help de-escalate the situation by lowering external pressures and allowing for a more focused, less reactive interaction.
Change the environment, change the dynamic.
The sources also unequivocally state that restraints and seclusion should only ever be used as a last resort, emphasizing the importance of preserving dignity and autonomy. And a very direct, vital statement. Is punching something healthy? No.
Right. Seems obvious, but good to state clearly.
This highlights that even seemingly self-directed aggressive behaviors are not healthy coping mechanisms and often signal a need for intervention.
What are the key predictive factors for violence that professionals, or frankly anyone observing someone in distress, should be acutely aware of? Our sources provide a comprehensive list, with one particular sign standing out as the most important predictor.
The single most important predictor of imminent violence is hyperactivity physical manifestations of escalating internal tension, like pacing, restlessness, or suddenly slamming doors.
Hyperactivity, pacing, restlessness.
Okay. These are external, visible cues that an individual's internal distress is reaching a critical threshold. Other crucial observable signs include an angry or intensely irritable affect, increasing anxiety and tension.
Like clenching fists.
Often visible as a clenched jaw or fist, rigid posture, a fixed or tense facial expression, mumbling, shortness of breath, sweating, or rapid pulse. Also, overt verbal abuse, profanity, argumentativeness, threats, significant changes in voice volume or tone, either excessively loud or very soft, intense or deliberately avoidant eye contact.
Eye contact changes.
Interesting.
Recent acts of violence, even minor property damage, stony silence, which can be incredibly unsettling, suspiciousness or paranoid thinking, signs of alcohol or drug intoxication or withdrawal, and, of course, the possession of a weapon.
That's a lot to watch for. Recognizing these specific signs allows for crucial early intervention, potentially preventing violence from erupting.
And surprisingly, the environment itself, the milieu characteristics, can significantly contribute to, or conversely, mitigate violence.
Yes, a loud or overcrowded environment, the presence of inexperienced staff, staff exhibiting provocative or overly controlling behavior, poor or inconsistent limit setting, or a general lack of staff consistency can all create milieu that is tragically conducive to violence.
So the setting matters. A lot.
Conversely, a calm, consistent, structured, and well-managed environment can profoundly mitigate potential aggression. Team support is incredibly important for managing acting out patients, emphasizing the need to don't scream at the patient, setting firm, clear boundaries consistently, and ensuring the team needs to be on the same page to present a unified, predictable front.
Team consistency is key.
Medications like lorazepam may also be used, again, carefully, to decrease acute violent behaviors. And in highly dangerous situations involving an aggressive spouse, the advice is clear. It's all hands on deck, meaning immediate team collaboration and to call security without hesitation.
All hands on deck. Got it.
Understanding these complex dynamics, both individual and environmental, isn't just for professionals. It's about recognizing the warning signs and creating safer, more supportive environments for everyone, whether at home, in the workplace, or in public spaces.
So what does this all mean for you? We've navigated a truly challenging but absolutely vital landscape today. We started by equipping you with the ability to identify the subtle red flags of domestic and elder abuse, learning to read the silent cries of educational neglect in children, and even delving into the complex psychological profiles of perpetrators.
A broad scope.
Then we transitioned into actionable, empowering steps for supporting victims, from meticulously preserving crucial evidence after sexual assault to building life-saving safety plans for intimate partner violence.
Practical tools.
And we concluded by delving into the profound psychological impact of trauma, understanding the insidious nature of rape trauma syndrome, and mapping out the critical phases of crisis, equipping you with insights for both assessing and safely intervening in high-stress situations.
The power of this deep dive lies squarely in informed awareness. This isn't just theoretical knowledge. It's designed to empower you to act with greater understanding, with deeper compassion, and with increased effectiveness when faced with these challenging, often terrifying realities.
Informed awareness leading to better action.
It's about recognizing the quiet, often overlooked signals, truly understanding the underlying factors that drive these behaviors, and knowing that you have practical steps and professional frameworks to lean on when faced with these incredibly difficult situations.
What if the most profound impact we can collectively have on breaking cycles of violence and alleviating suffering in our communities begins not with grand, sweeping gestures, but with the quiet, informed recognition of the everyday, often missed signs that frequently go unnoticed?
That quiet recognition.
It's about equipping ourselves, each and every one of us, to be truly aware, truly helpful, and profoundly compassionate in a world that so desperately needs it.